Welcome to With All Due Respect. This is a podcast for women over 40 who are looking for sane, frank advice about their health and wellness, especially through and after menopause. I'm Amanda Thebe, a personal trainer and nutrition coach, and the author of the best-selling book, Menopocalypse: How I Learned to Thrive During Menopause and How You Can Too. I'd love you to join me every week as I chew the fat with some fab guests on hot topics that directly impact you. I also know the power of conversation is lost, and there's nothing better than sitting down for a natter with your mate and putting the world to rights. And that's exactly what I'll be doing with this podcast. We'll really get to know my guests, warts and all. I've made it my mission to help you by exploding a few myths and presenting you with plain, simple facts. These inspiring conversations will hopefully empower you to be a healthy, strong, resilient bitch, just like me. Before we get started, don't forget to hit subscribe and leave a review, and then visit me at amandathebe.com. And now let's get started on today's show. Hi, welcome back to With All Due Respect. Hi, I'm Amanda Thebe. I have on the show today Dr. Kelly Casperson. Thank you for coming in today, Kelly.
Thanks so much for having me.
So I don't know if you follow Kelly on Instagram. I do. I've become a bit of a fan because she has just the best information out there. Dr. Kelly Casperson is a urologist and she's a wife and a mum as well. I like the way you put that in your bio. That makes me so happy. A sex educator and a top international podcaster whose mission it is to empower women to live their best love lives. I'm going to ask you what a urologist is in a minute, Dr. Kelly, but one of the things that I love about your work is that you talk about sexual health, intimacy, mind work, and the science of desire. And I really appreciate it because we're going to get onto the topic of menopause as well. It all interconnects. And there isn't just one answer to the questions about why our desire goes down, why our intimacy becomes more problematic. There's lots of things we need to work on. I've learned a ton from you. Your podcast is called You Are Not Broken, and it's also the name of your brand new book, which I haven't had time to dig into because it's only just arrived. And for those of you that are watching this, I'll show you a visual here. So we're going to try and cover as much as we can on the show about that. But I love your tagline, stop shoulding all over your sex life. It's awesome.
It's so good.
It's so good. Okay. So can we just start with actually what a urologist is, because I think that a lot of us don't truly understand that. I mean, I understand that it's to do with going to for peeing, the pee doctor, but it's obviously a lot more than that.
Yeah. Well, thanks so much for having me. I feel like I'm talking to a friend, which is why social media is so awesome, because I'm like, look at all my friends everywhere. It's so great. Urology is basically a surgeon who deals with the genital urinary tract in both men and women. The female structures have been ignored for quite a while. There's a subset of us urologists now who are like, this is pretty much the exact same pieces, just rearranged differently. And we're already the experts in the pelvis. So really taking on female pelvic structures, realizing the gynecologists have so much work to do. They can't do it all. So there's a subset called female urology, also called urogynecology, that really specializes in the external structures of the pelvis. But the vagina, we deal with bladder leakage and prolapse and pelvic pain, recurrent urinary tract infections, and then GSM, which is genital urinary syndrome of menopause.
Right. Yeah. And so there's a huge crossover then within your specialties. I didn't realize it was so intertwined, actually. That's so great to hear. And one of the things that I hear in my world, of course, is just how prevalent GSM is for menopausal women. What are the stats on that now? It's pretty high, right? That most postmenopausal women will get it.
Unless you're lucky, you're going to get it. It's 50 to 80% of women after menopause. I see it really kick in about 10 years after, which is a problem because the belief about menopause, as you know, is like it happened and then it's gone and then it's not a problem, right? And it's really the long-term effects of low estrogen on the pelvis really start rearing its ugly head about 5 to 10 years afterwards. And women have no idea it's because of menopause because we don't get much education on menopause to begin with, let alone, oh yeah, well, did you know that menopause or low estrogen is the reason that you get up more to pee at night, you have bladder urgency, it burns when you pee, you're getting more urinary tract infections, vagina might feel dry or painful or sandpapery and pain with sex. And they're like, no, I didn't know that was menopause. Because our education for menopause is so bad to begin with.
And I often think as well, like what you were saying about that 5 to 10 year window after menopause, I think it's not always associated as being menopausal because a lot of women struggle with some of the other symptoms you've said during perimenopause or the menopause transition, the constant increased with, going to the toilet during the night and some UTIs and vaginal infections. And I think a lot of them think, okay, so that's all the vaginal and vulva stuff done and dusted in perimenopause. But I know that the long-term consequences of the lack of estrogen in that area are pretty problematic. And I know for myself personally, I didn't see that in the way of like dryness, but almost like shrinkage. So I'm 3 or 4 years post-menopause now. And I remember looking in the mirror the other week. I mean, obviously I don't care. My vagina is everywhere now, so I'll just say it. But I remember looking in the mirror, which I don't do very often actually, and was like, oh my God, it's a completely different shape. It doesn't have it's not plump anymore.
A lot of people will notice that. And, the one way to really scare a woman is to be like, hey, did you know your labia minora can completely dissolve and go away and not come back? Right. Now, that's a very dramatic thing. But the labia minora, which are those really protective, soft tissues on the inside of the larger labia, help protect the vagina and the vulva from infection. Arousal structures are great for sexual function and pleasure. And they're really estrogen driven. When we see low estrogen, those tissues can really resorb or dissolve or go away. Very shocking. Nobody ever tells women that, but certainly something to be aware of.
And then I want to touch on one more thing before we move on to the desire intimacy thing. I want to know your opinion on in senior homes where we have lots of the older patients who have these recurring UTIs that can sometimes end up being fatal for a lot of them. Do you believe that? Because I've read so many different things, but for my book, when I spoke to the consensus was, I don't know why they're on a localized estrogen cream. What's your feeling on that?
I agree. We know vaginal estrogen decreases urinary tract infections by about 68%. The vagina is really protective. We need it acidic. We need a good, healthy microbiome. It actually acts as a barrier or a moat between the fecal contents and the bladder. So when that's unhealthy and not properly maintained, people are prone to getting more infections, which again, in the elderly leads to multiple hospitalizations, pain, suffering. They don't want to leave the house. They're really afraid all the time of infections. And it's so simple. And especially for the elderly, they might not be savvy enough to put a cream in the vagina. You can actually get a ring that stays in there for 3 months at a time. So I'm telling people this just to educate if you've got a mom or an aunt or some older individual that maybe needs a little extra help because you feel like, what else could we do? What else can we do? And there is something that we can do.
Yeah, great. So I'm really glad you've clarified that because it's so sad when I see all of these women suffering. And there was somebody I used to have an association with who wrote a book and it was called Me and My Menopausal Vagina. And one of the things that the author spoke about within the book was how it's sort of not just about your vagina or your vulva. When you're struggling with symptoms down there, it impacts every area of your life, your mental well-being, your emotional well-being, because you're so hyper-focused on either the pain or the fact that it's changing down there, or maybe you're weeing yourself all the time, or it can be really detrimental to our overall health, right?
Yeah, absolutely. And again, it all starts with education of why is it happening, to normalize it. And I'll see a woman, she's 63, she's coming in for these symptoms, and I say, you're right on schedule. Of course you're here today. This is exactly the time that you're here to talk about these things. Just to normalize it, right? Because they feel that they've done something horribly wrong or their body is doing something crazy that they have no idea why.
Yeah.
We just normalize it.
I know. I had lunch with someone the other day and she's my age and was going through exactly these things and said that the doctor didn't know what to do. So anyway, there's tons of resources on my website. Get Kelly's book because she talks about it in there. Please don't think that this is just you. So Kelly, when it comes to, I don't particularly need you to talk about menopause in this, but just about how we process intimacy in our body. I know it's a super multifactored conversation, and I never truly appreciated that until I sort of struggled with it a little bit myself. When I was going through menopause, my husband said, "Oh, I think I read somewhere that you get more horny as you go through menopause." And I said, "Oh, dude, I've been reading the exact opposite. Sorry." But then it made me aware that, oh, I have a partner that sex is still important to him and me. What if that changes? How do I start addressing that? But it doesn't even need menopause for those thoughts to happen, right? So I sort of want you to sort of lead the way on this conversation, what you've noticed in your practice and why you felt sort of compelled to write the You Are Not Broken book.
Yeah, I love it. It's a great question. I mean, one of the reasons why I love the topic of sexuality is because it's big and it's complex and it's nuanced and it's different for everybody. And that doesn't always come across in like a 30-second Instagram soundbite, right? And what comes across there is like, buy this product to fix your libido, or like, do this one easy thing to fix your libido. And so much is missing when we think about sex as like a quick fix, because it really is different for everybody. But I wanted to write the book because medical people, I started meeting in these groups, and the medical people, the people who prescribe the medications, are like, it's a hormone problem, it's a brain neurotransmitter problem, we got to fix that with a drug. Again, I'm overgeneralizing, but there's that camp. And then there's the camp of the sex therapists who are like, it's about the relationship, it's about communication, it's about learning how to talk about what you want. And so there's that camp. And then there's the kind of social scientist camp of like, women are oppressed in regards to our sexuality in our culture. Women are taught to judge their body all the time, like the society culture of why we have low desire. And it's all these pieces. And it might be column A for somebody and column C for the other person. But like all of that stuff in learning how to have the best sex life, you've got to be aware of it all.
So what's the difference between desire and like orgasms? Because I think that, you know, when I have conversations with women, I know it sounds like a really simple question, but there definitely is a confusion between the two. Like women will say, oh, like, I just don't want to have sex anymore. And other women, I can hear in their message that they don't enjoy it or they don't climax or whatever. And they're two separate threads in a way, aren't they?
Yeah, they're all, and again, it just comes back to the lack of education, right? We don't even know what the words are or what they mean. Desire, in like its purest form, is your interest in doing something, right? So I have a desire to go to Disneyland with my kids next summer, right? It's all it is like kind of this interest in something. And there's a chapter in my book, because I was finally like, can we swear? The chapter's called Fuck Desire, basically.
She's asking me. But
The point is like, it's your desire to do something that's not actually necessary for great sex. And there's this amazing book called Magnificent Sex by Peggy Kleinpatz. And she researches all these people who like are self-declared wonderful at sex and really enjoy sex. They don't talk about desire hardly even once in the entire book. And why that's interesting is because women are like, I don't have desire. And then they stop. And I like to use the analogy of exercise and for me eating vegetables, right? I literally have no desire for eating vegetables, but I know like my life's probably better with it. I want to incorporate it. I want to be a person who's healthy. So I just chop the vegetables and I actually do enjoy eating them, right? Same can be said for exercise. If we waited for desire to exercise, most fit people wouldn't be fit. And so I like to take the desire and be like, I'm never saying have sex that you don't want to have. Never saying that. But I'm saying if you want to have sex, make it sex worth desiring, right? And then realize sitting around waiting for the motivation to have sex is not going to get you the sex life of your dreams. So like if desire is not working for you, discard it.
I love that as well, because actually that's exactly how I talk about exercise as well, because we don't wake up in the morning going, this is it today, I'm going to go to the gym. And very rarely does that happen. But basically it happens because we show up and we do it. And then usually it's good once we start. Exercise I'm talking about, but also it's exactly how I feel personally about sex. And so I got to the stage where we weren't having sex and my husband was okay with it, but not. He would never say anything because he truly understood that it wasn't something to be forced. He wanted it to happen. But I got to the point where I was like, I can't just wait. We should just do it. We should just do it. Even if I don't want to do it, because I never have sex with you and never enjoy it. I don't get to the end and go, well, I wish I'd never done that ever. And so I started thinking of it, and I don't know if this is correct, but I'd worked on the intimacy side, like I held his hand more, I complimented him more, things I'd stopped doing. I snuggled up on the sofa with him. We went for walks together. We have date night. We have all of these things in place that we all enjoy. And I thought, why don't I just make it one of those things as well, that I just go, all right, well, it's in my head. It's Friday night. And it sounds like I'm scheduling it, but in a way, it helped me sort of jump back on the horse sort of thing.
Yeah, I think that's really important. And the other thing for people, again, it's how we're marketed too, right? Like buy this for your desire, change your hormones for your desire, is like desire is created in the brain. Right? We literally create desire in our brain. We can create desire for our partner. We can create desire for orgasm. Desire is a thought, and our brains are so amazing. We're allowed to have whatever thought we want. And that's really where the coaching part of the book comes in, of like, because so many women have underlying thoughts about sex that are not good, right? What do we call women who like sex? Bad words. Mm-hmm. So of course we wouldn't want to be that, right? So we have so much underlying negative thoughts. We don't realize that we can clean those out and create desire thoughts, create sexuality in our life that's fun and relaxing and intimate with our partners. And it's all within our power. We literally don't have to go buy or do anything. Like so many women, they just get stuck. They're like, I don't have desire. And then they stop having sex. And Rosemary Basson did this amazing research where she's like, for women, again, we're stereotyping, but for women, the desire actually comes with the doing. It comes with
That's one thing I was trying to say. Like it was almost like as soon as I started doing it, I get really, really into it. But the into it doesn't happen until we've started.
Yeah, it's the same as exercise, right? Like, are you doing exercise that you don't want? No. Like once you're into it, you're like, I really love this part of my life. But you're not sitting around being distracted by smartphones and work and stress and kids, like waiting to desire exercise. You just make it part of your life. It's part of your relationship.
And then what is that? I mean, I know I'm going to say, what is an orgasm? But how does that change as we sort of age? Like the orgasm, it might feel different. Is that okay? Does it change the way that we orgasm as we age? Can you sort of give some background on that?
So to separate, desire is your interest in doing something. That is purely like dopamine, reward pathways, and thoughts in our brain, right? Orgasm is the culmination of a certain combination of arousal, psychologic and physical, in our body that results in a muscle spasm release. We'll make this so nerdy at 0.8 second intervals. Like pelvic contraction, 0.8 second intervals.
That's crazy.
It's pretty universal. Like, they research it. They're like, it's a rhythmic contraction at 0.8 seconds. Might last really long. Some women, you can actually train your body. You can make your orgasm last longer. So that's what orgasm is. When we age, certainly hormones do play a part. Lower estrogen, lower testosterone, the tissues can atrophy. We can get what we call clitoral phimosis. So the hood of the clitoris sticks over the glands. It might be more difficult to get arousal. And then as bodies change, right? Whether it's diabetes or high blood pressure or just hormones or aging, we might need more stimulation. We might need different stimulation. The sex that we're having when we're 18 might not be the sex that works for us when we're 58. And that's totally okay. This accepting our bodies as we age and working with it instead of this rejecting, wishing it was how it used to be, that's not going to get us anywhere.
Yes, stop resisting it. And I'm like that with everything to do with the whole midlife movement, of course, is because if we can't work with where our body is and the changes that it's going to go through without us wanting to or not, we're going to always be up against challenges. But if you start to understand, educate and work with it, it just makes the experience so much more different. And so I did read a little bit of your book. I said I've only just got it, but I had a quick flick through, and I saw that you say something about as we get older, I don't want to misquote you, but our response or our enjoyment of sexuality and having sex changes. In fact, we see like our sex life can improve as we get older. Is that accurate?
Yeah, going back to that Magnificent Sex book, those people were not 23, right? And where do we get this image that like the 23-year-olds are having the best sex and it's downhill from there? Hollywood. Right? Where the young bodies are glamorized and spontaneous relationships, spontaneous sex is glamorized. So certainly we're getting that from somewhere. But if you look at who truly is having the magnificent sex, it's people who communicate well, They practice well. They say what went good, what didn't. I'm curious, what else could we do? They're playful with it. They usually have a lot of body acceptance. They usually love sex for the enjoyment that they can get out of it. It's not like a to-do list thing or like a should thing. So really, I think a lot of it, and that's what's so cool, again, why I love this topic, is like the personal growth involved in optimizing your sex life. You're going to get so much out of it.
And so that's so great to hear. And that sort of falls in line with some research that I found for my book that showed that just in general, as we get out of that bottom of the U curve of happiness, as we go up the side of the U into our aging years, that actually life just becomes more pleasurable, full stop. And I wonder whether it's just because we've been through our youth and then maybe through some challenging years, and through the other side, we just know what we want, and we just go for the things that we enjoy more. We get rid of the fluff, so to speak. And I can see that happening in the bedroom as well. Like, hey, this is what I know I want. And I know what you want, obviously, because it's reciprocal. Let's go for that. Okay, so now moving through specifically to sort of menopause, because there's a lot of menopausal women will be listening to this. What are a couple of the challenges that menopausal women are faced with? I know you talk about 2 in your book.
Yeah, well, I mean, it's so interesting because I got into menopause and became NAM certified because the question kept coming up like, yeah, but does your sex life just go down the drain with menopause? And I'm like, is there actually data, right? And the most important thing that predicts a woman's sexual satisfaction, there's 2 things. Number 1, availability of the partner, which I always joke, I can't fix that part. But number 2 is menopausal symptoms. So if you have poor sleep, if your anxiety is worse, if you're having hot flashes, I literally just talked to a woman this week who said, because of my podcast, she went to her doctor, got started on an estrogen patch. She said her sympathetic nervous system, that like on edge, that reactivity has calmed down so much. Her sex life came back. Her sex drive came back because she just wasn't on edge so much anymore. So it's interesting because it's like the hormones don't like by themselves increase desire. I'm talking about estrogen and progesterone, but treating menopausal symptoms will naturally increase your desire because you're not preoccupied with trying to manage this kind of a slightly chaotic event that's going on. And yet, again, it's different for everybody. I don't want to should on anybody's menopause. There's too much all in on hormones or absolutely no on hormones. And to me, I'm like, just get an education, try something, decide what's right for you.
Yeah, see what works for you. For sure, it's so unique for us all. But yeah, I think you nailed it when you said like the first symptom, like lack of sleep. Lack of sleep impacts every system in our body. It's like the worst. And if going on menopause hormone therapy can help with the sleep, then great. If that's not for you, then that's where we can look at all of those other things that can help with from a lifestyle or like non-hormonal pharmaceutical standpoint. It's why this full rounded education is so important for me. And I've had to pull back a little bit from the doctors that are throwing hormone therapy down as a one size fits all when we know it isn't for a lot of women. But I also hear from the women that do take it and feel a sense of normalcy comes back. And they're like, oh, it's so great. I've been able to exercise. And because I'm exercising, the knock-on effect of that is I've started eating more vegetables like you, and I feel better about the way I look. And actually that's impacted my sex life. I always feel like everything's got a domino effect, right? You've just got to find the solution that works for you. And in addition to that, I know there's a lot of talk about testosterone. It's very strong in the moment in the UK. The British Menopause Society, the RCOG and the Endocrine Society came out and reiterated that testosterone should only be used as an indication for low libido. It probably will help other things, other symptoms, almost like you just said, you take estrogen for something and it helps other things, but it is indicated for this HSDD and low libido. I tried it, didn't work for me, but that's okay. I know it works for other women. Can you tell me what the mechanisms of testosterone can do and like when it should be indicated or not? If that makes sense. Yeah.
So certainly with testosterone, it's for postmenopausal women, right? A lot of people don't know our ovaries make a good deal of testosterone, 1/10 of what a male testicle makes, but it's still significant. It's significant enough to be matching estradiol in our 20s. So what we've done, and once you see it, you can't unsee it. But what we've done is we've gendered a hormone. We call testosterone the male hormone. And what we've done when we do that is we say, well, women don't need it then. right? That's extra, or that's something that you don't really need. Instead of like, no, we have significant amounts of testosterone equal to our estrogen during some periods of our cycle in our 20s that was made by the ovaries that decreases also in menopause. Decreases a little bit slower. The periods stop before the testosterone goes all the way down.
And it also happens with age as well, though. It's sort of over a longer period of time as well, I understand, correct?
Yep. And same with men. Men will have a natural decrease, not all men, but
right.
men will have a natural decrease in testosterone as they age as well. But if you look at a hormone and say what hormone maybe is the driver of desire, testosterone really is that one, more so than they've found in estrogen and progesterone. And it's really that like seeking out behavior of like, I want to seek this out. Now, I like what they're saying in not just giving testosterone to everybody for any good reason. We actually experimented with that. We did that with the men, and then we realized that's not good. So what I see them doing with the women is just kind of preemptively, instead of putting all these women on testosterone, crazy doses, they're like, hold on, let's do this wisely. Let's not do the mistake we made with the men. So low desire is the indicated. It's still in America off-label. Right? There isn't an FDA-approved American testosterone product, which has its own host of problems, and we can get into that. But really, I had a woman. We started her on menopause replacement therapy. I always give that like 3 months to shake out because I never want to do everything at once and then wonder what the side effects from. Started her on testosterone. She called me. She's giggling. She's like, I just went away with my husband. We had sex 3 times this weekend. I like it again. It's enjoyable. My brain is clearer. I can make quicker decisions. And so it's like that low libido of like testosterone is probably just helping the brain in general. Part of that kind of byproduct is that libido. It's not like it's a spot weld on it. I just like exercising, sleeping, and eating right is great for your libido, right? So it's kind of an overall wellness.
So I noticed, and actually I'll just add on that in the UK and Canada, it's also, there's no female dosage as well, but doctors can...
Australia does.
Australia does. Hurrah. They're fairly advanced in everything they do. When you look at the Australasian Menopause Society, I just think, oh my God, this is how it could be, right? But you can still get it. Though you just have to apply it in smaller doses. And so what about I really only see this in America and at the testosterone pellets. I have a Facebook group. There's women in there that have been on it, are on it. There's some real proponents of it. But then I have women saying, my voice changed, I'm losing hair. And so can we talk about what pellets are and what the dangers are?
Yeah, absolutely. So pellets are I call them little bird seeds. They're like really small, they're size of bird seeds, and you implant them subcutaneously. Like your buttock is a common place to put it. And we do this for men too, so they all exist. Again, off-label for women. Why does this exist? Okay, so this exists because, this is my opinion, this exists because traditional Western medicine has done such a poor job of treating menopausal women. They are desperate. There are no FDA-approved testosterone products. Doctors don't know how to dose the off-label products, right? So women are feeling very bad and they want to feel better. So they go to a place that says, I'm going to balance whatever balance, air quotes, balance your hormones is. And I've got special training. And here you have to get my expensive blood tests. You have to get my expensive testosterone pellets. Basically, there are people who are trying to solve women's problems. They tend to make a ton of money doing it. Again, because Western traditional medicine does such an incredibly bad job of caring for women. So that's my, I hope, very global understanding of like why it exists. Now, the national societies have come out and said women are getting overdosed on this. We're seeing way more side effects. Some of these side effects are not reversible. So the societies are saying this is too high of a dose. And you'll hear that a lot in women. They'll be like, I felt fantastic. And then I kind of started to feel less fantastic and less fantastic and less fantastic on it. It's like they were getting a whomping steroid dose because testosterone's a steroid. Right. And then you kind of lose the efficacy of that, or you have to keep going up on your doses.
Well, I was going to say, and then they keep increasing the dosages, and that's when we see the problems with those sometimes irreversible symptoms, right?
Yeah. And I think women hear about it so much is because they're being marketed to. Again, women are trying to feel better. I don't blame them. I kind of blame the people who are making the money doing it, but they wouldn't exist or be so successful if traditional doctors did a decent job. So maybe that's where I'm putting all of my blame. But maybe we don't have to blame anybody, but just be like more knowledge is going to solve this problem.
Right, exactly. And, I have a friend who's a gynecologist in Austin, Texas, and he said that if he were to give pellets to every one of the patients that he sees within a month, he could make about 50,000 extra a month. So we know that it's making people very, very rich. And I just hate that women are continually exploited. That's always my thing. I'm just like, oh God, please make it stop. But you know what? At least we're now getting people like you, Dr. Heather Hirsch and Jen Gunter and people like that, all speaking out saying, there's other ways to do this and we can help you. And this is the education. So I thank you for that. So, I didn't realize the time. I could talk to you all day, Kelly. So with the book, You Are Not Broken, and the podcast, I would love it if we could sort of round up this conversation with the things that you would love women to feel or to know as they either leave listening to one of your podcasts or reading the book. And I don't mean like actionable things, more about like their worth, more about them as people as we age.
Yeah. I mean, I think going back, I guess this is where I kind of pull the spiritualness in, or like self-learning, right? Like there's so much to learn. Like, why are you even having sex? Are you doing it for somebody else? Do you realize it could be for you? Do you realize that the female body is capable of incredible pleasure and enjoyment, but you've never had permission to have the sex that you like? Right? Like there's so much to learn about yourself and your body, and those automatic negative thoughts, those ants, right? Those automatic negative thoughts of saying, I'm not good enough. I don't deserve this. My body's not right. The judging of ourselves, all of that. There's so much work in learning to be somebody who incorporates healthy sexuality into their life. And the other thing for women, because they're like, well, I need to do this for my husband. Like you will never get a great sex life if you're doing it for somebody else. If you're doing it for yourself and the stuff you're going to learn for yourself, that's where it is. And just like switching that lens of like, don't do this for anybody else. There's no point. You're not going to enjoy it.
I love that. That's exactly it. And actually, even though I said that was the last question, I have one more question. And it's all to do with self-pleasure. Right? I'm always flashing my vibrators about on Instagram, because I really think they're an important part of my personal sexual health. I mean, do you approve of them? Do you think there's something that women should sort of explore if they're interested or curious?
Yeah, I totally. There's this, I'm going to forget her name. She's an artist in Brooklyn who does a lot of clitoral artistry. I'm blanking, but she does a lot of really important clitoral advocacy. And she just posted this thing and she was like, vibration and lube to the clitoris is like heat and salt to food.
Oh, it totally is. Is it Donna somebody?
Oh, I forget. I follow her on
Instagram. If I find, I'll stick it in the show.
Dilemma of Desire is the documentary that she's in. It's fantastic. I recommend it. If you can get your hands on Dilemma of Desire, it's a fantastic documentary about this. But she said that, she did that post and I was like, yeah. We never got taught. We were taught that the penis is the answer to our pleasure, and it's literally not. And people will be like, oh, are you hating? And I'm like, no, not at all. Just education, right? So I think you should have 4 vibrators, at least the clitoral air pulse thing. You got to get at least 1 or 2 of those. I have a water pick and an electric toothbrush. We have technology that improves so much of our lives. Why would we not use technology in this department?
The clitoral air pump, one of my friends came around and said, because I was promoting some for a while, and she's like, I bought one and I felt like I was surfing the wave and I didn't want to come off. And I was like, that's exactly how it feels. And the Emma Thompson movie that just came out, where she admits she'd never had an orgasm. I bet there was so many women watching that going, I sort of feel the same way. And she shows you it doesn't matter how old you are, you can keep evolving in that respect. And I actually love the film because of that message.
I have to watch it. I definitely want to do a podcast on it. I haven't watched it yet.
It's completely a movie for you, without a doubt.
Everybody's loving it. And that's the thing. I think it's 10% of women, it's depending upon what study you look at, have never had an orgasm. And it's you do carry the clitoris around with you 24/7. It's always there. Let's prioritize learning about it.
I love it. So where can we find you? Where can we find you best? Where your podcast and your book? What's the best sort of place to look for you?
So the website and the Instagram are kellycaspersonmd.com. for the website. Books on Amazon, You Are Not Broken, Stop Shitting All Over Your Sex Life. And then the podcast is You Are Not Broken. It's on Apple, Spotify, all the main players.
Yes.
I do a little TikTok, but it's not my fave right now.
Not going over
Find me
there.
mostly on Instagram.
Yes, and please check Dr. Kelly out on Instagram. Thank you so much. Good luck with the book. Continued success with the podcast. It's one of my favorites. I love your voice. I think that's why. I think you've got like the best voice. I don't know why.
Thank you. My grandpa was actually in radio. So I like to think that there was like a genetic thing that happened for me.
Well, thank you everyone for joining today. I hope that was super helpful. Bye for now.
Bye-bye.
Thank you so much for listening to the show. If you like what you hear, then why not subscribe to this podcast and leave me a review? You see, when you do this, it helps to raise the profile of my show and attract new listeners. And it also allows me to continue to deliver valuable content with great guests. And in return for you doing that, I will send you my 12-week core-focused program called Abs on Fire as a thank you. Simply drop me an email at amanda@amandasteve.com and I'll wing that your way. Bye.